Hi everyone, Dr. Aubry Tager here. I want to talk to you today about thyroid and about autoimmune thyroid condition and T4 and T3. A lot of people really get confused on this topic, so I just want to shed a little bit of light on it. If you've been diagnosed with the number one autoimmune thyroid problem in the world called Hashimoto's, this is going to be something that is going to be extremely important to you. So without further ado, let's take a look at T4 and T3. Okay, so you've been diagnosed with a thyroid condition, potentially thyroid disease or an autoimmune thyroid disease, and your family doctor or your endocrinologist may have recommended certain medications. How do those medications work and what exactly is going on here? So first and foremost, we do have thyroid hormones. And what are those thyroid hormones? Well, what we want to do is we want to look at the two different thyroid hormones that are there. We have what's called T4, and then we have T3, okay? Now, first and foremost, when we're looking at T4, T4 is what we call the inactive form. So this is manufactured in the thyroid gland itself. Now, when we want to think of T4, we want to think of it kind of like a coffee bean. Okay? And the reason why we want to do that is because you can't really make a cup of coffee from a coffee bean. It needs to be converted into ground coffee. So, how does this conversion happen and what does this have to do with T4 and T3? Well, let's look over here. T4 needs to be converted to T3 to be a usable form. So this is what we call now the active form. So the active form of T3 is actually processed for the most part in the liver. There are other areas too, but this is the main area that this conversion happens. Now, in order for this process to take place, there are certain vitamins and minerals that have to be really present in the body, and we can't have any deficiencies in those. So when we see the actual vitamins that are needed for that, we need vitamin A, we need B2, B6, B12, we need iodine, selenium, zinc, and iron. So if we have a deficiency in any one of these vitamins, then we're going to have an issue with regards to converting T4 over to T3. Now, some other things too can also interfere with this conversion. Some of the medications that you may be taking. So what would those medications be? Well, things like lithium. If you've suffered already from a thyroid cancer, chemotherapy, beta blockers, corticosteroids, and oral contraceptives. All of these medications can interfere with that conversion of the inactive form of T4 over to T3. There is another process that we need in order for this to happen and that can interfere with things, and it's called methylation. But we can look at that in another video that we have entitled Methylation and the MTHFR gene. But if we don't have this process of conversion from T4 to T3, then we may be missing out on some of the problems that are occurring in the liver or secondary problems such as medications or vitamin deficiencies that may not be allowing your medications to work properly. Now, what are those medications? Well, with regards to T4, the main medications that are usually prescribed for that are Armour. So Armour Thyroid works on T4 and T3. With T3, it's mainly the synthetic form called Synthroid. And Synthroid is also known as levothyroid or levothyroxine. So just as the name suggests, those are synthetic forms of thyroid. So let's take a look back here again. Once again, we have thyroid hormones, T4, T3. T3 is the usable form. Medications that may interfere with that, vitamin deficiencies that may interfere with that. So if you don't have this whole picture and all you're doing is just taking Synthroid for T3, but you're still not getting better, some of these steps may have been overlooked. So I hope this sheds a little bit more light on thyroid hormones and autoimmune thyroid diseases. Once again, this is Dr. Aubry Tager. Have a great day.